What's up, everyone? Welcome back to the Sutton Sanctuary Podcast.
Brand new episodes with special guests and myself coming to you weekly.
Don't forget to hit that like and subscribe so you guys are up to date and get notified right whenever those new episodes are dropped.
Once you guys are done with that, head on over to Hydrate12 IV Therapy and Wellness on Facebook and Instagram and get your IV scheduled today.
The Sutton Sanctuary Podcast on YouTube and Spotify, as always. Thank you guys for watching. What is up, everybody? Welcome back. Another episode of the Sutton Sanctuary Podcast. Today, joining us, Dr. Derek Shelton.
Man, yeah, thank you.
It's nice to meet you.
Yeah, good to see you,
Thanks
man.
for being here.
No, thanks for the invite, man. I
Yes,
appreciate
sir.
it. Yeah.
Absolutely. I was speaking with Ramon a little while back, whenever he did the pod, and he was one that put me on to you.
Yeah, Ramon's a good dude, man.
Yeah, he said the same thing about you.
Yeah, he's a good dude.
He said the same thing about you. Yeah, I was kind of a little bit familiar with OptimizeU whenever I moved over here. I was on TRT whenever I moved over.
Okay.
I was out of a clinic over in Marion.
Okay.
True Test.
Okay, sure.
And so whenever I moved over here, I was wanting to transfer because I was just tired of dealing with 2 hours away from
No,
it.
sure.
It didn't make sense.
Yeah.
I ended up getting some test results back in my fertility. Sperm was at 0, had none. So I ended up coming off TRT and whatever.
Yeah.
But yeah, so like I said, I was already kind of familiar, and so whenever he was telling me about you, I was excited to get you in here. And
yeah, we're you know, I'm born and raised in the tri-states. I'm a Henderson guy, so I've lived there my entire life. So the you know, but you know, just like every Henderson guy, you have to drive to Evansville every day anyway.
Right,
so it's not that big of a deal. But
the same thing if you live in Carmine, where we're from, half those people drive to Evansville.
For something, right? Yeah. So, you know, I've always, you know, I always tell people kind of, you know, my background is in cardiology, emergency medicine, orthopedics. So I know all the bad stuff that can really happen to you.
Right.
You know?
Yeah,
So,
for sure.
you know, if you don't take care of yourself and if, you know, let yourself kind of deteriorate and just, you know, just let Father Time take its toll on you.
Yeah.
You know, I've seen all that stuff firsthand, you know, and to the terminal part of it, to the people dealing with it, trying to manage it and all that stuff. And, you know, without getting too controversial about thoughts on healthcare and stuff like that, you know, I've also dealt with that. And I've been in healthcare for going on 30 years now.
Yeah.
It's kind of hard to believe, but I've always taken an interest in men's health in particular, just because, you know, heart, it's always guys, orthopedics, it's always guys, you know, like, you know,
It seems like,
the bad stuff that happens in ERs, a lot of times a lot of guys too, but you know, that doesn't necessarily have anything to do with that. I mean, we're just kind of stupid, you know? But the hold my beer moments, but
definitely.
You know, so I've had you know, and I hate the word journey, but you know, I've had my own kind of little journey too, you know, with health, and I've always tried to stay fit, always tried to do the best that I could, but was never where I thought I could be at.
Right. Just felt like you could always kind of get more.
I was a missing piece. Like I just
you
felt
weren't
like
unlocking your full.
Sure. Yeah. I mean, I was, you know, just like everybody, you know, I hit the gym hard, but my diet was probably not great.
Right.
You know, if I wanted some pizza, I ate some pizza. If I wanted to drink a beer, I drank a beer, you know, but not to say you can't still do those things, but, you know, I really think the missing component of it was that. So I really got kind of, you know, and I'm kind of in that age demographic. I'll be 49 tomorrow. 49, so I mean, so I'm in that demographic. So, you know, just start searching around, and you know, there's plenty of places online, and you know, that are kind of, you know, to the layperson, it's probably great because you're just, you know, you're getting on there, you're filling out a questionnaire, and a week later you got some TRT, you got some testosterone at your house, or whatever else that you want to.
Right.
You know, as a healthcare provider, you know, that really didn't set well with me. So, you know, there are things you at least have to monitor, relatively safe, but there are things that you have to monitor. And I just didn't feel like I was getting the attention, I guess, from the online route.
I feel like whenever you get into things like testosterone, which tends to still be like a little taboo.
Sure. Oh yeah, reason. Absolutely. Yeah. Yeah.
And you bring up like you're taking testosterone and people are like, oh my God. Yeah. Immediately right off the bat.
Everybody. And the, so I started going down a COVID, I got really bored during COVID, and, started trying to figure out what it was I could do, kind of looked into starting your own online kind of platform. And again, I thought, well, then I'm doing the same thing that I don't like now.
Sure.
You don't have the time to devote to,
right.
If you had 1,000, 1,500 clients even, you don't have the time to answer those kind of questions. So just hunting around, find OptimizeU, loved the clinic, loved their style, loved what they had to offer and their kind of mantra that they went with. And, 2 years later, we opened one up here in Evansville. So there's 26 clinics nationwide now.
26.
It is the beauty of it is that it offers everything that you hear about. That's it's Miami and LA and Austin and all these places, and it's here.
Yeah,
and it's affordable.
Definitely.
So that's what I love most about it. I'm a Gen X kid, so I'm always kind of a down with the man kind of person. So I want to be able to bring those things and not be a value dollar driven, be value driven for the patient. So
that's always what I get asked about a lot. It's like, how much even is it?
Right.
I don't know. I was paying around $220 a month for testosterone. I was given an AI that I never really had to take. My estrogen never fluctuated. Maybe I came up a point or something.
Sure. Yeah.
And then the fertility, is it HCG?
HCG. Yeah.
I was taking that, which obviously it didn't do anything for me. I was going to ask you kind of what your thoughts on that were, because now I understand, obviously, after so long injecting with testosterone, your body eventually will stop producing it as naturally. But it was kind of my understanding with the HCG, it was supposed to mitigate that a little bit. Was I wrong in my thinking?
So it kind of helps maintain sperm motility and sperm count. Okay. HCG is what is detected when, in a pregnancy test.
Okay.
So when the female, pees in a cup and dips the stick in there, that stick is detecting HCG. Okay.
Gotcha.
So, what I typically offer and what my partner typically offer is that anybody that is having low testosterone symptoms, but is still kind of has the idea of wanting to have children or whatever, testosterone with HCG is an option, but I always kind of start with enclomiphene too,
That's what I started with, and they discontinued it and was switching everybody over, and they stopped with the enclomiphene. I don't know why.
I don't know why they would have discontinued it, but it may have been their pharmacy that they used or whatever. But the I'm always real hesitant.
Gotcha.
I also, I'm still a provider, right? So I still kind of question the motive a little bit, and we're all bros. I mean, I get it, we're all, I get it. I totally get it. But I do question the motive sometimes. And, if you really are worried about the fertility issue and you're young or you're engaged or have a significant other or just married and you're like, we're going to have children, well, then I really have to recommend that we don't go that route. Yeah, we just wait. You get your whole life, dude.
What
is it that you're really
what do you need in the next 6 months?
Right.
You're willing to, from personal experience, wreck that.
Right.
And you get that call from the doctor, and the lady doctor tells me that you don't have any sperm.
Yeah. Right.
That's
right. That's a devastating call, man.
Yeah. Because at that time, now I'm thinking like, am I even going to be able to give a future to my wife that she's wanting and expecting, that we have talked about?
Sure.
And now here I am. Yeah. Whatever. But it's
I mean, I can tell you that it hasn't been my experience too much that people that and of course, maybe a case, it does happen, but a therapeutic dose of testosterone and then coming off of it really isn't that much to really knock everything out. Depends on where you started at. If you started off super low, then that may do it, In
the 100s.
Oh, wow. So, yeah.
It's like 165.
Oh, geez.
Yeah. Okay. I've got paperwork to back. Every time I tell people that, they're like, really? Right. I'm like, I got the blood work. Yeah. It was 160s.
So the, it's a lot of times what we will see is people that come to us and they've been doing, gym bro protocols,
Sure.
and they're metabolically a mess.
Yep.
And we have to kind of
metabolically a mess, as in,
well, their liver's messed up. They're
pre-existing or just maybe,
who knows,
or who
right?
knows?
Yeah, who knows, right? Yeah, because they also don't go to the hospital.
Yeah.
We're guys, dude. We don't go to the hospital.
Right. A lot of people don't get their blood work done ever.
Right, yeah.
And that's something I always tell people now too. I'm like, you should just do that anyway.
Yeah.
Like, even if you're not taking anything every 6 months, once a year, go get it done.
Yeah, for what we charge, come in and get some a la carte labs, and it's worth your time.
Sure.
Yeah.
Yeah, I agree.
And then we'll sit down and explain it to you too. That kind of thing. But a lot of times what we'll see is the guys never had lab work. They've been on, trend cycles off and on every 6 weeks for 2 years.
Yeah.
And, they've ran out, or they've done this or something, some sort of life event has happened. A family has intervened. We've seen that before too. And they make them come to us, and we sit them down, and I have a 27-year-old guy whose testosterone was 27.
Whenever families are wanting these guys to come to you, is that like personality related? Are they being like, okay, like my brother here, he's off, like
I think so.
At that point, I'm sure their mental's probably not very good.
Sure, yeah. It gets a little bit out of our lane sometimes,
Sure,
because it's like, okay, like, here's what we do,
Yeah.
I can probably tell you where this came from.
Right.
The psych mental health counseling part of this has got to, we can refer you from somewhere, but that's going to have to come from somewhere else. I mean, it happens all the time,
Yeah.
And we're not the police. We're not going to, we certainly don't prescribe to people that are doing their own stuff. Okay.
Right.
But
which you can probably either detect from blood work.
Oh, certainly. Yeah.
You have guys come in trying to lie to you about it.
People are honest. No, I don't
that's
think so. A lot of people
It's kind of
are
hard to lie whenever that blood starts coming out.
Well, yeah, you can lie to anybody else. You can't lie to us.
Right.
And one of my primary drivers was that I want people to come in and have a place to come in where there's zero judgment passed. They don't have to be scared. They don't have to argue with their primary care doctor about getting some lab work, and then the primary care doctor is worried about their insurance company, covering it or whatever it is, you know. So I want them to be able to come in, get some lab work done, sit down with me and say, hey, I'm taking X, Y, and Z.
Right.
And I was like, well, you need to completely eliminate Z.
Yeah.
You need to get rid of X because your liver is this, or your kidney function is this, or, you're killing your endocrine system.
Yeah.
Yeah. And so the saddest thing I think is, and it's ignorance in the nicest sense of the word, it's people that they're going to the gym, they're hitting it hard, they see influencers, they're doing all these things, and they're like, man, I want to get fucking yoked and I want to do all these things. And they come in and they're dying. I mean, they look great, but they're rotting on the inside, and that's terrible.
Yeah.
And we have those conversations a lot.
Yeah. I feel like it's becoming a more common thing.
Certainly. Yeah.
Especially in the social media. It's, I talk about, it's like a fine line, because I made the comment earlier about TRT and the taboo and the steroids. And it just seems like, as much as, you don't want to you almost don't want to talk about it because you don't want to promote or these young kids or whatever. But at the same time, it's there's not really any sort of education being put out there for these young guys to really understand.
Right.
Even if it's just testosterone that you're wanting to run or whatever it is, it's you have at least really go into it with knowing what can happen and how real it is for a lot of people.
Well, and there's so much out there now. I mean, again, you can follow 20 people on Instagram or on X or whatever your pick is, TikTok, and get 20 different opinions on things,
Right.
The biggest thing, and we've talked about doing how do you approach education? How do you get, a bunch of high school kids?
Yeah.
How do you get a bunch of high school dudes in a room and say, hey, look, here's what this is, here's what happens, and then convince them that that's really what it's doing. Because at the time, they're 17, 18, 19, and they're
And we wouldn't have
taking
listened.
on the stuff. Right. They're like, do you see this? Like, I'm like, okay, like,
right.
No, I know you do. You stay in the mirror the entire time you're at the gym. But trying to figure out how to do that. So that's why we've kind of started, 2025, my partner, Jessica, and I, we kind of trying to kind of push out more educative kinds of things. And we've started our own podcast. And we're trying to figure out how to reach that population, going into gyms and, come and talk, Derek's going to come talk to you about steroids. Nobody's going to come in there, or it's, maybe they would, maybe we should try it, but shouldn't be a naysayer, but maybe just, trying to figure out, because that education is so important.
Yeah.
The guys that come into us in the deprogramming, there's a reason why our appointments are an hour. Like every person that comes in for us, it's an hour.
Yeah.
Some dudes are pretty straightforward. Some ladies are pretty straightforward. I've never taken anything. Here's my symptoms. I'm 52 years old. My test is 202. I can't sleep. I'm pissed off all the time. Gaining weight around the middle. Don't want to have sex.
Yeah.
Done. Everything else looks good. Good. Fine. Next.
Yeah.
The deprogramming of a lot of guys. I had a guy last night on a telehealth call that was on 900 milligrams of test a week.
Whoa. Wow. 900 a week.
900 milligrams of test a week. Now, for people that don't know, we typically do 150 to 200 a week.
Yeah.
Okay.
I was 160.
I can't imagine. So when I've seen a bunch of bodybuilding protocols and things like that. I don't know that I've seen with test
never
at 900 a week. Now you see the test base 200, 300, 400 even, but then you're adding your multipliers is what I call them. Is what your primos, your masterons, those kinds of things are what you're putting on top of that.
Which is going to bring a little bit of an increase.
Yeah, it's going to bring it up too. But 900 a week.
Yeah, I've never, even like guys I watch on YouTube or professional bodybuilders that I follow, and like guys that are very open about Olympia type cycles.
Right.
That I've never seen 900.
I don't think I've seen 900 milligrams a week. And that's what I told this guy. I said, I don't know what, there's a lingo that comes along with it. And you see it on like forums and stuff like that. When they say, I got my bloods done, I'm pinning this, I'm doing, it's like we're like, okay, here we go.
Yeah.
what is it? What is it that we're going to talk about? How much are you doing? So the, 900 milligrams a week. I told him, I was like, so that you're taking 4.5, because most test enanthate, which is what he said he was taking, 200 milligrams per mil. So I'm like, you're taking 4.5 cc's of test a week.
That is wild.
And he was like, yeah. I was like,
how about like his physical pain of just injecting?
Right now,
it's so many injections. Unless he's, you see people that are like, I don't know, I guess whatever you want to do, but like you get into like 1 cc, oil it in one spot at a time, like the lumps and the sore.
It hurts.
You're sitting there with a massage gun later on, trying to get it to break up.
Right. Yeah. So, and I was like, wow. He goes, how did you feel? I was like, dude, I feel great. I'm like, that's
I guarantee it.
But here's the
superhuman
thing.
right now.
Here's the thing. So he's 2 months off of it now. He goes and comes to us to get his lab work, having trouble with his girl, shocker, right?
Sure.
After on that, I always tell people there's no such thing as roid rage unless you rage on roids. Right. So if you're raging on them, you're taking 900 a week. Yeah. Well, then
you're raging.
Something happened. Yeah. Maybe something happened there. So and this may get a little bit nerdy into the weeds a little bit, but his total testosterone had dropped to like 327.
Okay.
Which I'm sure if you're taking 900 milligrams, I mean, it's probably, I don't know, but it's probably 5,000.
Has to be
cruising at 5,000.
Has to
be. His free testosterone was 17 something. So I always tell people that the difference between free and total testosterone is like your gross and net pay. Think of your paycheck. Okay. So your gross pay is what you have. It's the number that you tell your buddies that you make, but it really doesn't mean anything, right? It's not what's going into the bank.
Right.
You know, if I make $120,000 a year, well, but that's not what I have.
Right.
You know, your free testosterone is what gets deposited in the bank. That's what you have to do all the fun stuff with.
Gotcha.
You know, so when we see things like testosterones that you can tell are coming down, but a disproportionately, and the disproportionate stuff is not anything really scientific. It's just you have to look at thousands of these numbers to say that looks a little higher than what your total relative to what your total is. Okay. So say if you have a total testosterone of 327, I would expect your free to be somewhere around, I don't know, 5, 6, 7, maybe, you know, but when it's that high, I said, this is the perfect scenario. So I'm your boss to this guy, you know, and I've given you a salary, you know, I've given you this great bump in your salary, this huge bump in your salary. So all that money's been deposited for a long period of time. And then I come to you and I say, hey man, we screwed up. We've been paying you too much. I'm going to take that away. I'm not going to make you pay anything back that we've given you. Right. But I'm going to take away what you have now. And so there's the perfect scenario, right? His gross pay drops, but what he has in reserve is still disproportionately high to what he has. Yeah. But that 17.3 2 weeks ago may have been 50. Right. We don't know. Yeah. You know? Yeah. Unless you. So I told him to come back and see me in 6 weeks and see how he feels then, you know, because hopefully he's just not completely tanked himself. Right. You know?
Yeah, that's I'm trying to think. I set around like 700 whenever I was running TRT, and you know, I think I got retested again about 3-4 months later, and I had just completely just crashed completely.
And 700 is within a normal range, and that's an optimal. You know, those are optimal kinds of numbers, and that's what we. Now, normal is not optimal. That's our mantra. You know? So it's this, you know, a normal testosterone by our lab standards 265 to 916. I'll always tell people that a guy with a testosterone of 266 and a guy with a testosterone of 914 is the difference between Peter Griffin and Captain America.
Sure. Yeah, you know? Absolutely.
But normal. Okay. Right. You know, so those are the people that we work with, you know. I gotcha. That's the token, you know, kind of OptimizeU patient that comes in.
So seeing more of the I don't want to say average guy, but just not so much as the athlete. I know you have, I'm sure, plenty of athletes that come through, but it is more of just the normal guy or girl that's wanting to optimize. You know, I was wanting to just kind of get your thoughts, because I have a lot of people, and some people I've had on the podcast that have asked me about TRT, guys into their 40s, and for some reason they're pretty hesitant about it. I don't know if it's the needles. I don't know. They're worried about like side effects. Yeah. They're worried about, and you know, who am I to, you know, tell this guy like, well, you're probably not gonna have any side effects.
Sure. Right. Yeah.
I don't want to be that guy to tell someone that.
Yeah.
Because you never know.
Right.
But just from my little bit of experience, it seems like I've never seen anyone that has gotten on TRT really for the sole benefit of optimizing health, and then been like, that was
terrible idea. Should have never done it. Yeah. You won't. Okay. Right. I mean, there is a little bit of, historically, all the data that surrounds steroids, TRT, testosterone, anything at all, is pretty old data. Okay? Sure. And we consider and quote sources and studies all afternoon, but for the most part, you know, if you were researching things in the 70s and 80s on steroids and testosterone, where are you going to go to find your population? The gym. You're going to go to Venice Beach, Gold's Gym, where like Hulk Hogan and all of these Schwarzenegger and all these guys are there, and you're going to run labs on them, and you're going to do this, and then you're going to automatically kind of deduce that, well, it's testosterone is bad for you. If those dudes were taking everything, right, raiding the vet office, and getting all of this stuff, you know. So testosterone, there's no link between testosterone and heart disease and cancer and all that. There's things that can happen, but that's the beauty about having a brick and mortar place to go to, right? Yeah. And again, it was the problem that I had personally with the online things, where it was like,
I've always steered people away from the online.
Yeah,
people came to me and they're like, you know, you can get online and there's doctors online. You can
easy,
talk
yeah,
about
right, yeah.
And I'm like, yeah, but like, what if something, God forbid, something does happen though? The middle of the night, you wake up with a crazy feel, like when you get online and like hope some guy on the other side of it, probably an AI bot talking back to you.
No,
know?
Exactly. It's exactly what it is now.
Yeah, you know, it's like
you
could just get Chat GPT and get the same answer you're gonna get from that.
So you know, the worrisome, the needle thing. I always tell people we do offer cream.
What about the pellets?
We're not fans of pellets.
The problem with I had never heard of that until I had a buddy that was working out in Arizona.
Yeah.
That went to a TR or a hormone lab out there, and they offered the pellets.
Yeah.
And I had never heard that.
Yeah, we're not a fan of pellets, and the reason why is that every person that comes to us that is coming off of pellets to switch to either injections or creams gives us the same story. I feel great for like 3 weeks.
Gotcha.
And then you peak, and then it's just downhill from there. So you imagine imagine if I could give you a incredibly long-acting dose of testosterone all at once, and then, but you had to wait 5, 6, 9 months, however long it takes to get more.
Right.
Okay. Well, I'll try it once, and so that peak feeling that you feel at like week 3 or 4 is as good as it gets.
Yeah.
And then it just kind of dive bombs from there. And granted, you're not, if your testosterone gets up to 11, 12, 1300 or something like that on pellets, and it's going to take a while for that to go down. So you may feel pretty good.
Right.
Most people aren't going to feel a difference unless it's kind of up here a little bit.
Yeah.
Between 1300 and 900 or
definitely.
And 900 to 800.
Yeah.
But when it starts whenever you were at like 11 or 12, 1300, and now you're down to like 6, 5.
Yeah. It's setting in.
And now I'm like, well, now I'm getting tired. Hey, doc, when can I get these new pellets in? Well, you got 4 more months left. I'm like, shit,
Yeah.
So we just get this, and it's a procedure, and you're doing this kind of thing, and it's just we just don't like the pellets. We're very, very patient centered.
Right.
So I want you to be able to. I want to provide you the education where you can control the thing. If I give you pellets and I recheck your lab work and you've had some kind of rare but happens hematocrit reaction where it's through the roof, then I've got to take you back and I've got to take those pellets out. If I'm giving you injections, I can monitor the dose.
Sure.
If you start having sexual side effects or something because your testosterone skyrockets in your aromatizer, which means that your estrogen skyrockets with it.
Yep.
Now all of a sudden you don't feel anything when you're having sex or having trouble with erections or those kinds of things. Well, we can do things about that.
Gotcha.
Pellets is a little bit more difficult. It's just if you have a problem with pellets, it's a process. If you have a problem with injections, well, I'll just tell you hey, when you go to the 5, now go to the 3.5.
Yeah.
And see how that does.
Yeah. Yeah. I've heard a lot of talk in like the bodybuilding community too, kind of going back to what I said earlier about like spacing out the injections. For one, the injections at a larger size, you're dealing with, actual spot issues as far as lumps or the soreness, whatever it was. But yeah, breaking those up into those smaller bits and, I don't know. Every time that I have someone come to me and just ask about testosterone and they find themselves like being hesitant, like I hate to like be some guy that's just out here like trying to push this.
Right.
Like,
yeah.
I don't
send him to us. I mean, we're glad to talk to him. We have a beautiful office staff that takes care of, a lot of those kind of frequently asked questions kind of things, What is it with the injection? Well, the injections are, it's an insulin syringe, it's a 0.5 cc twice a week is typically what we do. And you just put it in your belly fat or just kind of at the top of your butt cheek or somewhere like that, and the biggest pain that I tell people is that it's an oil. So it's thick and it takes a while to draw up, and we're dudes. We're not very patient, So it's like I'm trying to wait for this.
Especially in an insulin syringe. If you've never drawn testosterone out of a vial, drawing one into an insulin syringe is annoying.
It takes a while. It's drip. drip, drip, drip. It's 1 minute and 12 seconds. I've timed it. So
for what? For full CC or half?
For half CC.
For half.
1 minute 12 seconds. Yeah. So you got 1 minute 12 seconds first thing in the morning, a couple days a week, and other than that, it's fine.
Yeah.
The cream part, we do offer the cream, and I'm always super hesitant about the cream and social issues. Okay, because first of all, with cream, there's like this whole ritual that kind of surrounds its application. You have to do it twice a day.
Every day?
Every day, twice a day.
Wow.
It has a very short half-life, which means that the medication's gone pretty quick.
Yeah.
Whereas the injection is longer acting, so you only have to do it twice a week.
Gotcha. Mm-hmm.
So the cream is you apply it to your scrotum. Okay. You're a dude, obviously. It's a get up, shower, dry off, apply the cream, wait, put your clothes on, go about your day, make sure you wash your hands really good. Horror stories of transference. So you've got kids in the house or you've got grandkids.
Yeah.
Okay. And you're using testosterone cream that's on your hands. You do your morning ritual. You go in, your granddaughter's in the kitchen waiting for you to eat breakfast. You pick her up, you give her a hug. That's on her skin now. And you can have
messing with her now.
Nightmare scenarios.
Wow. As in the cream basically running its course on
goes right to. I would not go to her if it goes to. Wow. Yeah. So there's a couple of cases out there of that.
Have you had that experience through your clinic?
No. It's just whenever you talk about it, you always do that. A lot of times guys that want to start with cream because they have some sort of needle phobia or needle kind of want to shy away from it or whatever, a month or two later, like just
yeah.
Just because it's just it's a ritual. It's twice a day.
Wow.
Before you go to bed, just like every dude, I'll fall asleep on the couch, and then you wake up and you go crawl in bed, I'm not gonna go. I'm not gonna go do that and
clean off and then have to do it and wait and
So there's a compliance issue with it. There's an effect issue with it because of the compliance issue, and just give me the injections.
Yeah, I'm sure.
So
that's wild. Yeah. Wow. I'm gonna do some research on the transfer of that.
Yeah.
Because that's crazy. I can see what kind of issues do you think you would notice if that was to happen? Like we're talking hormonal type of stuff.
Oh, like 9-month-old with pubic hair. Yeah, right. That's the word.
Oh my God.
It's
Damn, I didn't. Yeah.
Yeah.
Stay away from the cream.
Stay away from the cream.
Stop.
Well, I mean, if you're an older guy and you don't have grandkids around, or whatever it is, then fine, do it.
Yeah, I guess.
I mean, we have
you
a
just
budget.
have nothing to do all day.
People that do it, but at the end of the day, it's we're a business and it's more expensive for the cream, but it's like just. Mm-hmm. That's just been my experience with it. That nobody, everybody always switches back.
All right.
There's a compliance issue with it. Yeah. If you want all this, the wow factor that kind of comes along with it, it typically doesn't, because of the compliance issue. And, there's that. So,
I can see.
There's a lot of other delivery systems out there that they're looking at, for like troches, which are the things that kind of dissolve in your mouth and that kind of stuff. There's so many variables that kind of comes along with that, like mouth hygiene and absorbability and pH and all these kinds of things. It's just do the
I don't know. I'm one of those people
that do the
get the needle. What are you doing? That's how I look at it.
Put your to begin with, right?
If I don't walk out here with needles, I'm not doing it. Like, what are we doing?
Yeah, but there's that's the available forms of it. And it's
a mental thing too.
It is a mental thing.
I think, as far as whenever I inject it, I feel like I'm getting more in my head because I'm injecting it. Right, and that's absolutely just shit in my head. But
well, there's again, we start everybody with you do have a full lab panel, okay. And again, I keep going back to this. We're guys. We take care of women too.
Definitely.
Beautiful nurse practitioner out there that knows everything there is to know about women's health. Named Jessica Blanford. She is awesome. She takes care of guys as well.
Dr. Jessica Blanford. She had a hold of her women.
She takes care of all the women. But
I got you.
from the, we don't have lab work. I came back. It's not surprising to me because again, I have this ER kind of background because
Gotcha.
most people go to the ER for their first sign of a disease is their trip to the ER, kind of thing. But we get this full, incredibly comprehensive lab panel. You come in, we sit down with you, and every symptom of low testosterone or the typical symptoms that people present to us with are pretty vague.
Yeah.
I'm tired. I'm fatigued. I can't sleep. I'm irritable.
A lot of these people you think having more issues than that, and they're nervous about it. Because I remember my first meeting with the doctor, and I was having ED, like, pretty rough.
Yeah.
And I was 23.
You're right. Yeah.
So like that just made me want to
right. Yeah.
thinking about it.
Yeah.
So when I visit, there's guys in there probably that are kind of ashamed or think that like, wow, I'm fucked up.
A lot of guys you have to draw it out of. And I just I always share what I've gone through too, and what kind of brought me to it. And whenever I see you in the office, we're sitting down like this. It's not me behind a desk. You're not sitting on an exam table, so it's a talk,
Yeah.
So, we get this full comprehensive lab panel, and we make sure you're not diabetic. Make sure you don't have any kind of underlying kidney, liver, electrolyte issues, deficiencies, underlying infections, anemias, some cancers, prostate issues, thyroid issues. We do cholesterol panel that gives us, this kind of like 50,000 foot of overall health. There's a lot of controversy that surrounds cholesterol these days.
Definitely.
What it actually means. But, at the end of the day, if your total cholesterol is like 400 or 500, you're probably not healthy.
Right. Yeah.
So I always use it as that. And, then we get this full hormone panel, and then we can kind of deduce what is kind of going on with you.
Definitely.
But always want to, when you have a concierge medical service, the critics will always say that it's just a money grab, like you're trying to sell them everything.
Sure.
Well, no, I'm not going to sell you anything. I'm not going to put anything at risk on me or the clinic or whatever,
Yeah, you came here.
Yeah. And it's I am truly there to make sure that all our bases are covered, and then we go into the questioning, like, okay, so you have tell me what's going on. Well, it's all the vague things that are, don't have any sex drive anymore, can't sleep, all these kinds of things. And then we'll just go from there.
Yeah.
Not all the options,
Right.
If you're a younger guy and you're having those kinds of things, we talk about enclomiphene. We talk about, if it's just a sleep issue, we talk about stuff for that.
Yeah.
And it's not, we don't prescribe sleeping pills or anxiety pills or depression pills or anything like that. We try to treat it from a bioidentical kind of
What's your experience with guys coming in on things like SSRIs and those types of things? They have maybe some backgrounds, anxiety, depression, that kind of thing.
Yeah.
Getting their hormones in check, bringing that testosterone back to an optimal level, and then seeing guys come off of those things.
Sure.
And losing a lot of that anxiety they thought they had.
It definitely happens. Things like SSRIs and, definitely anxiolytics or, like Xanaxes and things like that, cannot be just stopped,
Right. Absolutely.
Very deadly, if they do. So, I don't, again, I've been in medicine for, 27 years at this point, So I have a great respect and appreciation for what goes on there.
Absolutely.
I also know the pigeonhole that they're all kind of put in as far as management of people, you hear all this stuff about, doctors that, we didn't have this kind of talk in medical school and it's kind of shied away from. And then you get all the conspiracy theory, big pharma guys that are saying it works. That's why they won't let you have it. They want to, the sick care is where the money is.
Works.
Like,
that's why they can't.
Right. Yeah. So, and to a degree, I've witnessed some of those things. We can talk about, kind of BPC 157 in a minute, but
I'm taking it right now.
Good. Yes.
Just because I've had some shoulder pain.
Right,
So I'll put that out there.
Right,
I'm taking that right now. I was going to ask you about peptides in a minute.
Yeah. So I just wanted to provide a different avenue for people to come to.
Absolutely.
I'm not going to step on anybody's toes. I'm not going to say anything at all disparaging about what you've been treated with or whatever. You come to me with a bunch of anxiolytics or SSRIs or whatever class of anxiety depression medication you're on, and your testosterone is 199, and you give every sign of the world, why not try it?
Yeah, because that's not working.
Yeah, and I don't, there are things that are messed up,
Yeah.
And it's proven to make people feel better.
Absolutely.
It's to me, my experience on it was it was like the first thing, like within a couple weeks, like your mood kind of lifts a little bit.
Definitely. Confident.
Right. Yeah. So I have 3 big kind of pieces of artwork in my office. I'm a big movie guy. So
Okay.
I've got a big mural, big Fight Club mural. I've got a big Lebowski mural, and then I got a Conan mural. Okay. All right. So 3 of my favorite movies of all time. And I always tell people that those 3 movies represent kind of the progression of testosterone benefits. Okay. So, Fight Club, if you've seen it, and I'm sure hopefully everybody's seen it if you haven't watched it, but the main character, Tyler Durden, completely has identity dissociation because he's just exhausted, right?
Yeah.
He's just exhausted with life.
Right.
He's just beat up dude, he's
Yeah.
work job sucks, he's traveling all the time. He's got all this high stress kinds of things, deals with really high stress situations, and just completely dissociates.
Yeah.
So the very first thing that I noticed was that you just start sleeping.
Okay? Yeah.
Sleeping then leads to the number 2 mural, which is Lebowski. Lebowski, if you haven't seen that, it's not the Jeff Bridges character is the dude, right? But the dude that's the main person that you think of when you think of Big Lebowski is just nothing bothers him really,
Yeah.
Russian mobsters come in and take a piss on his rug. This guy's like, man, what are you doing? Why are you doing that, man? So there's nothing that really bothers him.
Yeah.
So that's number 2. Okay. So the irritability, snappiness,
Yep.
moodiness, and all the things that kind of come along with that, it goes away too. If you're eating right, you're doing all the things, and you're going to the gym and you're just missing that component.
Right.
About 8 to 12 weeks into it, if you're keeping that lifestyle, you're going to notice some aesthetic value to it.
Absolutely.
Especially with guys. I always tell people that testosterone is not a primary weight mover. It's a primary body composition mover.
Yeah. So
you may not, if you're completely fixated with numbers on a scale, you're probably going to be disappointed.
Definitely.
Unless you have 60 or 70, 80 pounds to lose,
Sure.
But if you're relatively just a big, thick guy or whatever, you're going to notice that your clothes fit better or look better, or your belt is getting cinched up a little bit tighter.
One notch tighter.
That kind of thing. Right. Yeah. So those kinds of things is what you start to notice. And then, again, I think there's a synergy that kind of goes along with that. So I'm sleeping better, so my mood's better. I'm sleeping better, so my mood's better and my recovery's better. I'm sleeping better, my mood's better, and now I'm kind of motivated because I'm rested to go and do all these things. So I think I don't know that testosterone gives us this big umbrella of things that it fixes.
Yeah.
I don't know that if a piece of it goes here and a piece of it goes there and it fixes all these things, but as far as a whole,
it seems to make things kind of fall.
Kind of like this domino effect with kind of the symptomatology that comes along with low T, whatever that people call it.
It just makes sense.
Sure.
Like whenever you break it down, just how you said, it's like, well, if you increase this, and next thing you know, you're feeling better in this aspect. And now because you're sleeping better, now you're in a little bit better mood. Well, now that you're in a better mood, you have more time for maybe to be higher confidence.
Right. Yeah.
Whereas before you were spending all day mad at the world. Right. Now your confidence is up.
Yeah. Brain fog goes away. Cognitive ability kind of goes up, able to think more clear. If your head's straight, then maybe maybe I should go to the gym, or those kind of things.
Next thing you know, you're making a little bit better decisions.
Not go to the gym, but do things that are better for yourself, and you start feeling better.
You're giving a little bit more effort in your day to day.
Right, yeah.
And next thing you know, now your marriage is a little bit
better. Right, yeah. Now just a more pleasant guy to be around.
Now your kids are a little happier because maybe dad's a little more energetic.
Yeah.
And now
playing out in the yard again.
Yeah, he's running around and
that's the story we hear all the time, man.
And then typically in return, probably anxiety will lower over time.
Yeah. And so there's a again, I don't, I don't ever make claims that, it's a primary anti-anxiety treatment.
Absolutely.
Okay. But, I think there is a sort of a global effect or a domino effect of starting testosterone therapy, that if I start to feel one thing, it's a multiplier of all the other things down the road.
Yeah, I agree. Yeah, and the reason I asked is because, like I said, whenever I went in to get my first doctor appointment with the guy over there at True Test, and I think at the time, I know I've talked about this before, but I was taking 2 or 3 different medications every single day just to get through the freaking day, it seemed like, and I was struggling with alcohol and all sorts of stuff then. And I had basically given in to the idea that my doctor had told me that I would, be on these medications for the rest of my life. And, I had something that was just how I was born, and this is how it's going to be. And at the time I didn't care. I was like, whatever, if I feel better, that's fine. And that's whenever I first had that appointment over there, and he brought up that he kind of the same thing you're saying. He was like, look, he's like, I'm not saying that it's directly going to relate to your anxiety. He's like, but just the improvement of quality of life. He's like, I do see a lot of guys that are then able later on to back off of these things.
Yeah.
Which I was able to do. And now I'm completely off everything for months now. And I was nervous whenever I come off TRT this last time. I'm like, well, shit, I'm not on any medication. If I come off this testosterone, is the whole house going to crumble?
Sure.
I think just getting those hormones where they needed to be, getting myself right mentally, whenever I did come off those medications, I'm now sitting on a whole different foundation than I was before.
And so we'll get into a little woo-woo here with this, okay? Because whenever I talk again, in those hour-long appointments, I talk a lot about, really focus on, and that's with any medication that we do, we do with peptides and things like that, is that you're investing in this to do it, make note of the habits that you're picking up on the way, so if you're on TRT and there were life stresses that previously, before you're on it, would just throw you over the edge, make you drink more, make you take more pills, make you whatever, in the way that you react, then note that,
that's hard to do.
It is. It's very hard to do.
Yeah.
But it comes part of the process, right?
Yeah.
When we talk about, diet, nutrition, weight loss, those kinds of things, it's the same sort of thing. Remember what it is while you're doing this, and how you feel, and how, mindfully take note of what's going on at the time, because if there is a point where you have to come off of it, it doesn't mean you have to regress, right?
Yeah.
It doesn't mean you have to fall right back into that place, always it's the reverse psychology or whatever, but I'm like, you being off of it now, and remember something that would have triggered you before, and say, hey, whenever I was on that, this didn't bother me near as much. It shouldn't really bother me this much.
Yeah, definitely.
So we try to kind of stress that too, because there's people that have to come off of it for whatever reason, financial, sperm counts, whatever, and it's my preference would be like, every guy that's done having kids and doesn't have any health issues, and just, why wouldn't you, it's kind of what my personal statement on it is. But use the time that you're on it to remember, and learn something from it. Not that it's, I don't want to relate it to like some kind of spiritual journey, but there's something that comes along with it.
Absolutely, yeah. Especially whenever you're so used to operating at just like a baseline,
right? And
you've never experienced really just how good you can feel. It's really a crazy thing. Especially you're like a month in. And it's the confidence, and like I think it was Andrew Huberman, whenever he said he's like, testosterone, what does he say? He's like, testosterone makes hard work feel good.
Mm-hmm.
Is how he described it. And
Yeah.
that's a really good way to put it. Like
Yeah.
before, whenever you think like going, you know, I know we're constantly going back to the gym, but I think it's what we do.
It's what we do, right? Yeah.
And so, but as far as like going to the gym, you know, you go to the gym and you're like, you know, fucking legs a day,
Right,
whatever it is, and you know, you get it done, and like being on testosterone, it's a different mindset. That hard work, you're in the gym, especially once like the blood starts flowing and the testosterone starts flowing.
Sure.
It's a whole different. I like that though. It makes hard work feel good.
Yeah.
That's a really good way. Whenever I heard that, I was like, yeah, that's a good way to put it.
Yeah. And it's again, it's not a magic injection. You
Definitely.
know? You still have to get
you
up
have
and
to
go
want
do it.
to.
Right. Yeah.
Yeah.
Yeah. I tell everybody that, you know, to get to that aesthetic thing, you have to be doing it. You know, it's not going to, you know, it's not going to make you get off the couch.
Definitely.
When you get off the couch, you will have more energy to go do stuff, but you still have to get off the couch.
Yeah.
It won't tell you not to eat an entire pizza, but you know, if you don't, then it will help along with
Definitely.
it, you know?
Yeah.
So there's a lot of, like I said, I'm a big education guy that comes along with stuff, you know, and especially with peptides, especially with, well, it's peptides really. But
I wanted to ask you about peptides because it's sorry to cut you off.
No, you're fine.
Again, people ask me about peptides, and I've mentioned I'm taking BPC 157 and TB 500. And peptides are really a not talked about thing. It seems like I feel like I
talk about them really. From our standpoint, really, a lot of times, you know, it's a, you know, they're not FDA approved. They're not this. They're not that.
Yeah. That's
why
people are like
some research lab and buy them with Bitcoin or something. You know, but it is
for research purposes.
For research purposes only. You have to, you know, when you order them, you have to name which lab you're having them sent to. You know.
Yeah.
Shelton's house, whatever, I don't know. But
the Sutton's.
Exactly. I'm gonna start using that. Just
go ahead. There you go.
Box with my name on it.
There you go. Order an extra one.
You know, it's a peptides are, you know, the generic, you know, kind of definition of them is, you know, it's a group of branch chain amino acids that make your body do something that it already does. You know. A lot of controversy on them about what they, you know, who should be using them, at what point are they, you know, useful and not useful. Do they cause a lot of the issues that the medications that would typically that you're trying to replace do, you know?
Right.
So the biggest, you know, a big class, and what we get a lot of questions about is the growth hormone secretagogues.
Yep.
Okay. So, you know, a lot of
looks good on paper, and you see like,
yeah. So a lot of, you know, there's a few. There's one called MGF. There's one called Samoralin. There's one called sarcotropin. There's more of them out there. You know, I think MK677. You know, like I think a lot of
that's one of the newer ones that I've heard. That's one that's being pushed on social media right now. The MK677.
So, ibutamorin and ipamorelin and Samoralin and those kinds of things. It is you know, they're basically little signals that tell your body to release more growth hormone.
Yeah.
Now, in theory, that should be great, right? But just like anything else, our growth hormone declines over time. You know, so does it make sense for me, 49, to tell my body to make out more growth hormone if it's not making it to begin with, you know?
Right.
So
I see what you're saying.
You know, it would be a, you know, so who does that?
The bridge of natural or not with testosterone is a little easier than.
Where does that fall at? So kind of the bioethical debate is that, okay, so Samoralin, for example, is kind of marketed as this growth hormone secretagogue. Should we be checking, you know, IGF-1 levels and that kind of stuff? Should you be treating it like a, you know, if they're diabetic, you shouldn't be giving it to them, you know, because it causes insulin spikes, and, you know, you shouldn't eat carbs around it. You should take it at night, all these kinds of things, you know? So should we, and at what age group does it really fall under where it's probably not effective anymore? You know, And then the opposite of that is, okay, so what group is it effective in? Well, it's probably the 20 to 30-year-olds.
Yeah.
And why are you giving 20 to 30-year-olds some money? So it's
because they're already producing.
Right. Yeah. Yeah. So I get, I understand the debate of it. I really
definitely.
do. I love the idea of it. BPC 157 is a beautiful.
Can you give your definition of it for people that maybe don't exactly just know what
BPC
the BPC
157, BPC stands for body protection compound. 157, it's isolated in the gut of every human. We all have it. And if you add more to it, then it's a healing property. So you can, BPC 157 used to be, wink wink, available at as an injection at the site of injury. So basically it is a concentrated volume of healing properties that goes in there, kind of starts healing things up, and usually kind of can be used with PRP, which is when you spin your own blood down, all the healing properties injected into the site, or stem cells used in conjunction with that. TB500 is kind of the same thing, thymosin beta 500, isolated from our bodies and then put back into a spot where it is. So if you can imagine, things like PRP is really, it's about as simple of a science as you can come to, it is, I draw a volume of your blood out. I spin it down in a centrifuge. I filter it to the point where I'm getting out all of the healing stuff. So when you cut yourself, the red stuff that comes out is made up of a bunch of different kinds of cells. Okay. So if I can filter that out to all the good stuff that goes to the site whenever you tear a muscle or strain a muscle or strain a shoulder or something like that, and inject it directly into that site, in theory, all that property, that concentrated volume of that, instead of the circulating volume of a bunch of other stuff and that, into that site should help. Okay. Same thing with BPC, same thing with, the TB500 kind of stuff. All of those things go to that one area, and ideally it heals it up. A lot of different thoughts on that. I think it's wonderful. I've used it a bunch. I take oral BPC 157 daily.
Damn. Okay. I didn't know. I'll have to talk, because I get mine from my wife, because she's got her IV company.
Oh, okay. Yeah.
So she has access. To those things through the provider that she uses. And that's where. Before I was using the sketchy research company online, which I don't know if I really call it sketchy. I mean, it's a whole sponsored athletes.
It's
just hard whenever people ask me, and like, where do you get yours from? And I'm like, well, this is the place. I'm like, but whenever you get there, it's gonna tell you
not FDA
approved.
Yeah, not used for
all this. Yeah, I was like, just ignore that. I just ignore that.
I did not say that.
Yeah, well, you shouldn't say that. Yeah. I'm not a doctor. Okay, as long as we're all clear about that, I'm nobody. So.
Yeah, no, I mean, and I think that a lot of the worry that comes along with them is that we still live in a country where you and I could go down in your garage right now and start a supplement company.
Yeah,
as stringent as the FDA is, you and I can still go down there and put whatever we want to in capsules that we bought off Amazon. We could come up with a label and ship it to everybody. Start a website, start shipping it out tomorrow, and call it whatever we wanted to. And as long as as long as it's not laced with fentanyl or anything like that, typically, I mean, there's thousands of them,
What is that? Why is that blocked off from things like the FDA? Why is it like because it seemed it kind of like a little bit different subject, but just like get into like marijuana or that kind of thing. It's like, I just don't get, first of all, like there's so many cases and studies and testimonies of people for positive things coming from these types of compounds or whatever it is. It's like, it's not like you guys can't find a way to tax the hell out of this and make money as well. So like,
I'm
just surprised that them as government or whoever, like, that they don't want a piece of it, like they haven't just figured out a way.
They want a piece of it. And that piece of this, that starts with the fact that I shouldn't be able to buy it for $30 a vial from mypeptides.com or something like that. So they have to strip all that stuff off the market first.
It's tough to do.
And they call it some different name, and now it's
resell it
$2,500 an injection.
Yeah.
I mean, that's that's, I don't think I'm saying anything conspiratorial there. That's pretty.
No, I mean, that just seems like that's how it works.
It's the, it's kind of the same thing that happens with the terzepatides and semaglutides. They get pulled off of the shelf, and typically, to me, that means that they found some other use for them that they're going to start marketing as a different name, and they don't want compounding pharmacies or wherever your wife gets her stuff from, to have access to that thing.
Yeah.
Because compounding pharmacies make it way cheaper than whatever it is. So if you ever want to examine the kind of corruptness of big pharma, look into compounding pharmacies and what good they do and why they get in kind of stay in trouble a lot of times.
So I don't know if this is exactly what you're talking about, but this just came to mind. It was a clip from another podcast I watched where I believe it was a pharmacist, and he was speaking about the gag clause. And he had a gag clause in his company that was like, I don't remember what medicine it was, but woman comes in and he's like, I can just sell it I buy it for $2, I can sell it for $4. Everyone's happy. He's like, but as soon as whoever gets involved, he's like, now I have this gag clause. And if the lady brings up that she has insurance, as soon as she brings that up, he can no longer tell her that he can just sell it. He has to run the insurance, and he's got to charge her triple or double, whatever it is. And I don't know. I didn't know if like you had...
I wouldn't comment on it because I'm not that familiar. I mean, I'm familiar with
the hormone clinic, you guys, it's not.
Well, we're cash only. Yeah, we're not.
Exactly.
And there's 1,000 different reasons why we don't mess with insurance, and that's okay. Yeah, because
I just say that's a disgusting.
It's disgusting.
It's just
it's disgusting.
The fact like he has to literally. He's like, if literally as soon as she like brings up her insurance, he's like, I stop talking.
Yeah, and I don't. I've worked with kind of a lot of groups that work with insurances too, but I know that. Yeah, there are rules out there that exist that like offering cash-based services in a place where you have insurance and you can't. It gets real muddy.
Yeah, I'm sure.
First, and we don't. That's why we just don't mess with it all. We like, well, I can go get my I can go get my primary care doctor to give it to me. I'm like, okay, well then go do that. And, I don't. Right? Yeah. And if they do, good. But
and then I feel like they can just like discontinue that at any time though. Can they just pull that or be like, I'm not?
Oh yeah. I don't, So we see that with with peptides a lot.
Do you?
There's some rule, and I may get the numbers wrong here, where there's any the approved peptides can be no more than 122 branched chain amino acids tied together. Okay. And so things like Sermorelin, maybe 80 or 90 because it's been around for a long time. Okay.
Gotcha.
The things that kind of pop up, and they're around for like 6 to 8 weeks, and then they go away is probably because they are more than that.
Yeah.
More effective, more potent at where they work, or something that they really,
I would like to know who sets that number.
Yeah. Well, I mean, just a bunch of nerds.
A bunch of out of shape fucking people.
Yeah, I don't know if they're out, but the chemistry kinds of things, and I get it. There's guidelines because the chemistry of all of this, and again, this is going to be a very kind of elementary explanation of it. The way that I have to understand things is that if I take the the chemical compound for whatever, I mean, say whatever medication. I can honestly think of medication. Levaquin, okay, which is an antibiotic, okay? But there's a chemical compound for that, right?
Sure.
If I take that chemical, the chemical compound is what has the trademark on it, okay? That's what the company owns.
Okay.
All right. And then they trademark the name and all the other stuff that kind of comes along with that. But the compound, the actual medication is the CHO with the lines and the ends and all that kind of stuff. Okay.
Okay.
If I can figure out a way to add some little, inactive group onto that, that doesn't necessarily change the properties of the medication, but on paper, if I'm drawing it out, looks different.
It looks different.
Sometimes you can get away with that, and now it's something new, and we just call it something different,
How often does that happen?
Probably way more than what we want to do.
Yeah, that's kind of a scary thought.
Yeah,
how easily they can.
I'm sure there's a lot of legal protection that kind of comes along with that. There's a reason why they're just multi-billion-dollar companies, but if they would let things like that slide, every basement chemist would be making, everybody would be making,
right,
their own stuff. But I think that, I try not to get too conspiratorial about it all, but I think there is some validation in thinking that there's a reason why they don't allow peptides and things like that to be kind of roam free, or that they don't allow people to make their own decision about whether they want to take them or not. And obviously it's not too stringent because we can all buy Bitcoin and we can all do that, and we can all,
it's like kind of, they're not care that.
Right. Yeah. They're not asking for my Federal Research Lab ID number, whenever other stuff. So
we're just shutting these places down if it's that serious.
Sure. Issue. Yeah. So I think there is a little bit of momentum for them, and I think that,
I hope so.
Yeah. I think with the, I don't know if I don't get too political either, but with the current administration, it seems like that they're kind of pushing for those things, but then the next day it seems like they're not. So, who knows?
Yeah, you can't really keep up with it.
Right. Yeah, I don't keep up with it, but it's interesting times for all of what I like to call kind of medicine 3.0. It's medicine 1.0 is kind of the Civil War kind of thing.
Yeah.
Something gets infected, you cut it off. 2.0 being, like the, sick care kind of thing, what we've been living through now. And now this kind of preventative, kind of, attacking,
getting a little ahead of the curve.
Trying to get ahead of things, and it is really interesting. And that's why I'm there. I mean, that's what I want to do.
I read, online, you had some sort of experience in your life roughly 10, 12 years ago.
Oh yeah,
that changed your point of view or had some sort of impact.
Yeah. So
I didn't see any specifics on this. I saw that something had happened.
So I did competitive jiu-jitsu for a while. I always tell people I did jiu-jitsu before jiu-jitsu was cool.
Okay, I got you. I got you.
Yeah. So I was a fat kid growing up, and got in shape around 20, 21. Did some, got into more endurance kinds of things, and then started doing jiu-jitsu around probably 2005, 2006 or so.
Okay.
And loved it, and loved the guys that I was going with, and went 3 or 4 or 5 days a week if I could, and just, we were doing some take down drills, and just my leg got destroyed, so I walk funny, like my foot doesn't work and that kind of stuff. So,
okay.
And, to have, and I was one of those exercise addicts, I was addicted, 6, 7, 8 miles a day running in the gym 4 or 5 days a week, jiu-jitsu, that kind of thing. And, it was, you never know, when you had that stuff taken away from you, I didn't know if I was going to walk again. I didn't know if I was going to keep my leg, there was a lot of emotions going on. We got it fixed up, but it was, I could barely walk. Everybody that didn't,
you weren't healing very well.
Everybody that didn't know me that, beforehand thought I had cerebral palsy.
Oh, wow.
I walked, I had to walk with a cane and all kinds of stuff. So,
not that that's the end of the world.
No, but
but that's crazy.
But I had 3 kids. I had a 2-year-old at home.
Yeah, I mean,
so it was like I didn't.
You need to be active.
Yeah, right. It was my only boy too. I had 2 girls and a boy. So, this is it.
Yeah.
So I really, I just kind of had to, you get depressed. You you're down in the dumps. I was never going to hurt myself or anything like that.
Right.
But, just kind of like giving up on everything.
Yeah.
And, you just, some things happen where you just have this epiphany and you're just like, honestly, you're just like, fuck it. Let's get off your ass and go do something,
Yeah.
And that had nothing to do with testosterone. I was way before testosterone days, but, just, staying driven, staying focused, and really started to kind of work back on some things, and
I gotcha.
got, I've got basically a robotic leg at this point, which is still my skin on the outside of it, but that's about it.
Yeah.
But yeah, I mean that that's what's kind of made me who I am today. What motivates and inspires me was having that taken away from me.
Yeah.
And I would never ever wish that on anybody, and I would never want to not have a way to mitigate that if it's available.
Definitely.
So that's a big reason why OptimizeU is here too, because I was 46 whenever I started TRT, and you notice those kinds of changes. And I did Ironman. So after this, I did Ironman.
Wow.
And the biggest thing that I ran into was that I couldn't recover. I couldn't recover anymore. And I don't know what kind of, if you read a bunch of stuff about people that are Ironman competitors, there's like a psychological thing that comes down afterwards, like this huge exhaustion, meltdown kind of thing. Can't sleep, can't do that. And it's very true. But started looking at things again, and it was like, okay, your levels are this, you can try this, you can try that. Okay, I'm going to try that. And then I was like, okay, well, that's what it was. And then, I went into Ironman thinking that I was going to do one every year, and that was going to be like my thing.
Yeah.
And I did one. I was like, So then I thought about, what the next step is, what I always wanted to do. And whenever I had this kind of a pivotal moment, after my leg injury, I just decided I was going to do something every year. So now I'm doing bodybuilding now. So it's
cool.
That's the next thing. Yeah.
You're going to?
I am. So
you're looking shredded right now.
Thanks, man.
Are you getting ready? Are you competing in May?
Yeah, I'm competing in May.
Hey, I'm going to be there too. Let's go.
Yeah. So I'll be there in May in the
hell yeah
Masters division, hopefully by myself, so I can bring on.
Yeah, you're looking jacked, dude. Yeah. I was going to ask you. You said you were how old?
40. I'll be 49 tomorrow.
49. Yeah. You're jacked.
Yeah.
Looking shredded.
Yeah.
I know you're on bodybuilding diet, but what's the diet looking like?
So, I mean, obviously in the cut now, right? Yeah. So, deep in the cut.
Deep in the cut.
So, not really in any kind of a deficit, really. I mean, I still feel pretty good. I'm hungry, but I still feel pretty good. I have, it's chicken and rice is like 100 grams of rice and 150 grams of chicken 3 times a day. Some Greek yogurt, eggs. I do get 2 pieces of Ezekiel bread in the morning.
There you go.
But I mean, I'm in the shape of my life. I feel great. My labs look great. All of that stuff looks good.
Yeah.
I'm not. I don't. It's we do in-body scans, and I know there's controversy about those, but I do an in-body scan every Sunday fasted, and I was like 75 or 70% muscle mass on my weight and was like 4.8% body fat. So
that's low.
Yeah, I'm ready.
That's awesome.
If I could just
how low are you looking for?
I don't know.
Do you have a number?
Whatever. No, I don't care. No, I'm really just getting it. It's just a thing for me to do. I just want to get up there and just do it. And if it's something that ends up being fun and I like it, then I'll continue to do it.
Yeah. If
it's not, then I'll just move on to the next thing.
Yeah.
It hasn't been too bad. I will say that I'm doing like an hour and 20 minutes of cardio a day.
I was gonna ask what you're.
And it's just like
you split that up. How do you do that?
Split it up 8 ways.
Yeah, different machines.
Right. Yeah. You get bored on the Stairmaster and you go to something else. But I try to make it 40 in the morning, 40 in the afternoon.
Gotcha. I say about 40 a day, and that's enough.
Yeah, it's enough. I try to do it. I always like to lift in the evening, so I get up and do fasted cardio, then I shower and go to work or whatever, and then lift in the evenings, and then try to do some more cardio after that. And
I gotcha.
Sometimes I'll kind of mimic it with a sauna or something.
Yeah.
Just get the
sauna at 20 minutes is work.
You got sauna for whatever's left over if I get bored with it. So
I gotcha.
Yeah, it's fun. I've got a great coach.
Who's your coach?
Toga Tamazican. He's out of Vegas. He's a badass dude. I love him.
Hell yeah.
We went to the Arnold's together a couple weeks ago.
Yeah, and had it. Ohio.
Yeah, Columbus. Yeah. So just a good dude and really kind of down to earth. And but pushes you, like
Yeah.
he calls you on your bullshit, and he knows when you're bullshitting. I mean, like all of us do, and if
Yeah.
you're used to that kind of, everybody else loses on this. Why aren't you? Well, you're not special, like, oh yeah, you're right.
Yeah.
Okay. Yeah. Probably did screw something up.
Right. Yeah. Yeah. I ate 3 pieces of bread this morning.
Right. Exactly. Yeah. But, yeah, it's not terrible. Like I said, we'll see, I've still got 5 weeks left though, too. So I mean,
You have another calorie drop, or are you?
Oh yeah. Yeah. I think there's 2 more calorie drops. So we'll see,
Yeah.
but yeah, I mean, we'll just roll with it, man. We'll see
Yeah.
what it does,
That's awesome.
Yeah.
Hell yeah.
I enjoy the challenge of it all,
For sure.
and again, it's nothing that I didn't grow up doing or anything like that. I wasn't an athlete, I was a fat kid,
Yeah.
and so it's cool to kind of see what you can do. And I don't want to, toot my own horn, but the part of the OptimizeU thing too is that, if you come to me as a 40-something year old guy and well, I've never done this. I'm like, you don't have any excuse with me, man.
Yeah.
And some, I think it identify with a lot of people.
Yeah.
It resonates with them,
Yeah.
So
That's why I was talking with my wife before you come over here. I was like, man, I hope I just don't look like an idiot in here. Like he's gonna be in here talking over my head the whole time.
No, dude. I have to, that paycheck thing, that's, those are things where you have to understand.
Yeah.
So I have to break it down as minimal as I can because it just relates to people.
Yeah. That's the best way, especially when you're talking about, again, into the taboo subject of testosterone, and people are already kind of on edge. The last thing they want to do is go in there and meet with someone that's a real surface level type of person.
Right,
and it's
cellular
like,
level, blah 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 blah, and all this stuff.
Yeah.
I don't even know what you're talking about.
Yeah, I have no. I need to know, is the hard-ons coming back? Like, is my wife gonna still want to leave me because my attitude is so poor? Sure. Like I need you to tell me really how this is gonna work.
Right. Yeah. And I think that it's a and that's my specialty. I love I'm a talker if you haven't figured that out yet, but it's my wheelhouse. Like I love the health, fitness, exercise, bro talk. As much as I hope they're doing it safe and everything, I love whenever, people come in there and they like, hey man, am I doing this right? I'm like, no, and you need to, we need to talk about, the health effects of a lot of these things that you're doing, But those are my favorite kind of things because they're kind of a mystery. Sometimes you get to figure them out and it's, and they get better. And countless, and this is a message to everybody that may be on, taking substances that they probably shouldn't be, but most people feel much better on just a regular old dose of stuff.
Mm-hmm.
You don't, I promise you, unless you're getting on the Olympia stage, which, I wanted to be a baseball player for the Cardinals when I was growing up too.
Of course.
We're not going to, you're probably not going to happen.
Yeah. I hate to break it to you. All that hard work stuff you hear about with those guys on the Olympia stage. Yes, they do. Yes. But they are genetic freaks outside of that. You have to remember they are off of all compounds. They're still bigger than you.
Right. Yeah. So, So there's I to really have to question, the 39-year-old guy that's been on Tren and all this other stuff for years. I'm like, what are you doing?
Yeah.
Like, well, I don't know. And that's not, I'm not saying that cynically, I'm saying that
not to kill your dream.
What are you doing? What is your goal? What's your end game with this? Like,
because it's it's not like a lot of things, you put hard work in, you get back out of it. You're putting in the hard work, you're doing these things, but these other things that follow along are actually killing you.
You're actually killing you.
Killing you.
Right.
You're seeing it a lot. Younger guys all the time. You hear every other week, it seems like you're reading about some young guy.
Oh, absolutely, dude. And it's, we had we have a conference every year that we all go to for education. And, there was 2 years ago, I think it was, there was a guy there that was talking about, autopsies of bodybuilders, and like, Dallas McCarver, which is, passed away a couple of years ago, young guy, up and coming kind of thing.
Mm-hmm.
Testosterone at time of death was 5,500.
God.
It's just not necessary. It is. it's just not necessary, you know, but, you know, there's also the adage that, you know, if you lined up a bunch of Olympia competitors and you asked them all, you know, would you want to take home an Olympia this year and die in 5 years? Or would you want to have a healthy lifestyle but never win the Olympia? And most of them are going to say, I'll take the risk and win the Olympia. Mm-hmm. You know, so there's a lot of, whether it's like a dysmorphia kind of thing, a body dysmorphia kind of thing, or whether it's a bigorexia or whatever it is, you know, it's if it's you know, it's a lot of it is up here.
Yeah, and I think that's another good point to make if you know, any young guy that's wanting to get into bodybuilding, you need to understand these guys out here that are really doing this shit will die for it.
Yeah. Yeah,
they will. I mean, you see it.
They'll tell you they will.
Get online right now. Yeah. You'll find the latest guy that it just happened to. Yeah. You know, and those so. If you're going to bring it and you're going to step in and you really think, you better really be ready to die for it.
The other thing, too, I always tell young guys is like, you know what? If you're going to the gym and just to get yoked, girls aren't looking at you, dude.
Yeah, you're wasting your time.
You're wasting your time.
The eyes you're getting in that gym are from the guys.
From dudes. Yeah.
The whole time. Right. The girls are mad that you're in their way.
So if you're comfortable with that, then, you know, go ahead. But, you know.
Yeah, the girl's going to come up to you to tell you to please get out of the way.
Right, yeah, exactly. Yeah, like, you lug.
Yeah. Oh, man. Before we get you out of here, you just started your own podcast.
I did, man. Yeah. So we
plug that in?
Sure, man. Yeah. So we Optimize Evansville podcast studio on YouTube. We have 2 episodes out now. It's called Better Human. It is literally just like this, dude. I'm just talking with some guys. We have several episodes in post production and several of them scheduled. So we have other show ideas to start, but we just started up. So we'll again, it's it's not all about hormones. It's not about exercise and bro talk. It is, you know, to me, optimization, and again, kind of what we alluded to earlier, is not just about hormone balance, you know, or physical fitness. It's spiritual, it's financial, it's everything that kind of comes along with that. So that's who I want to bring to. And again, those people are here. It's not, you know, you don't have to get a hold of all these, you know, Rogan guests and things like that to get all the stuff. Yeah. Those people are here. Like, you know, you know, I've got a guy that's going to come in and talk about breath work. He's been doing that in Evansville for like a decade.
Really?
You know, it's like, really? Yeah. So, I mean, like, it's like, no, you know, really? Yeah, yes. Yeah. So, I mean, you know, and he is, you know, he's a yogi. He's done breath work. You know, his breathwork courses, all of these kinds of things. He's going to come in and talk to us.
Off type of guy.
Right. Yeah. Well, yeah. I mean, and you know, I got a seal coming up, you know, like it all, you know, that,
oh, really?
You know, cool. Like, you know, so, we have 2 of the most badass female jiu-jitsu competitors in the world here. You know, at their level.
I don't know a whole lot about it.
Right. Yeah. Yeah. But, you know, so they're going to come in and talk to us, and they're going to tell their stories and what motivates them to do that.
They live here?
Yeah, they live here. Yeah.
Damn, you have to put me on it.
Yeah.
Yeah, that's cool.
So, I mean, they're you know, that's, when we have those kind of guys coming up. It's me and my buddy Scott. You know, we're kind of doing it together. I have a wizard of a producer named Dakota DeGraw. Look him up on Dakota DeGraw Photography, Dakota DeGraw on Instagram, all that stuff. He's fantastic. And so, yeah, and it's just fun, dude.
Yeah.
I mean, like, you know, it's just fun to sit down and talk and just, you know, whatever. We're not trying to, you know, I mean, I guess we would take some ad money. I mean, if you got it.
I mean, if it's out there.
But, you know, it's definitely not the motivation behind it. You know, it's just, to me, is that I want the word to get out about the services that we offer, because it is not, you know, we have cold plunges, we have saunas, we have red light therapy, we have float tanks. We have cryo. We have
in there. The float tanks are cool. I've done that before.
Yeah. So, I mean, we have all of this stuff that you've heard about, peptide therapy that we can come and talk about and maybe get you on. You know, all of these things. Panoe is a really cool thing that nobody's ever heard about. But it's like a VO2 mask, and it like does metabolic analysis, like 26 markers. So it's like, you know, are you burning carbs? Are you burning fat? Here's what your diet needs to look like. You know, and it's just a mask that you breathe into.
Wow.
You know, so we have all that stuff. It's just, the marketing of it is hard, and it's not just in freaking LA and Miami.
Yeah.
There's lots of really cool people right here.
Definitely. Well, that's what I've noticed now that I've been reaching out and like trying to get connected to the Evansville area. Yeah. I'm like, there's so many people doing cool shit around here. You know, there's so much of it. And especially with the, you know, the hormone clinic, or I think people get the idea, then they tie it back to just weightlifting and
They do.
bodybuilders.
Yeah,
and
it
so
is.
they're like, well, that's not for me.
It's a
I'm
really
not into
hard.
that.
It's a really hard kind of stigma to break. You know,
Yeah.
kind of is that the no, this is not what that is at all. It helps. You know,
Definitely.
but this is definitely not what the primary driver of it is. You know?
And honestly, I feel like because most of the time, like bodybuilders or your guys that are more in shape, whatever it is, they're probably feeling pretty good compared to the average Joe walking through Walmart that doesn't train,
right? Yeah, sure.
Stays up all night, whatever the case is. So really, the people that really might benefit from stuff like this are those people that are not in the gym. And
some of my favorite patients, and it's just because it was me, right? They're doing all the things that they think they're doing right. You know, they're trying to follow some sort of macros plan or a diet or whatever, and they're going to the gym and they're doing all the things, and they're just not doing what they're just not getting the benefit out of it or getting the effect that they think they should be getting. You set some realistic expectations for one,
right?
And then two, you get them started on whatever it is that they need. And a lot of times it's the missing piece. And then they come back in at 6 weeks and get repeat lab work, and they're like, yes, thank you,
Yeah.
So it is incredibly rewarding. We literally have hundreds of patients at this point, and looking to expand and really kind of broaden our reach through podcasting, through education, those kinds of things about all of these topics.
Yeah.
So you're not just hearing about it on Huberman or
it's people right? People that see you in the gym,
right?
And they're probably like. And there's probably a lot of people that see you in the gym that like to hear you talk about these things, but are too afraid to come up and they don't want to bother you. They're like, damn, I'd like to just hear that guy talk about some stuff.
Right, yeah. So I mean, in anybody can come up to me in the gym. I'm not
sure, yeah.
But it's a privilege to be able to bring it to here and talk about it. And I don't want anybody dying. I don't want anybody getting sick. I don't want anybody having any kind of irreversible problems that they can't deal with because they did it out of ignorance, in the nicest sense of the word.
Yeah.
But I just ever since I've been in healthcare, I just want to help people. I just want to, and this is to me, this is the best avenue I think I can do that in.
Yeah, kind of the lost art of it too.
Yeah,
it seems like.
Yeah, it's it's a lot of fun. It's very rewarding. Patients love it. All the services, and again, it's right here. So
you said that you guys at OptimizeU, you guys have like the infrareds and the cold plunges and all that. Do you guys have like a monthly membership to come in and use these things, or is it like appointment?
We do, yeah. So if you have, if you're a hormone member, if you're a member that's receiving medications and one of our patients, then you get all that stuff for free.
Oh, let's go.
It's just added in.
There you go.
And again, it's because I wanted to offer it to you. I don't want to make money off. I don't. We have to keep the lights on. We have to pay everybody, of course.
Absolutely.
But it's I want people to experience that.
Yeah.
And I don't want it to be cost prohibitive to anybody. I don't want just,
it sucks the amount of people that
Jeff
are like
Bezos to be able to do all the longevity crap, right?
I want take advantage of their health because they can't afford it. That's super sad. You hear like, I would love to do this, and it's like,
and most people live that anyway through even with insurance. It's the number one cause of bankruptcy in America is medical debt.
Yeah.
So I don't want to be, we're definitely not overpriced. We hear every day, just heard it yesterday, that, oh my gosh, you guys are too cheap. You're too cheap. I was like, we're just fine.
Yeah.
We're just fine. What we offer and the benefit that people get out of it, I do not want it to be cost prohibitive. Because it is, I think it works.
I agree.
And I think that if you can't bring that to the people, then I don't know what good I'm doing.
I agree.
Yeah.
Yeah. Damn. Well, anything else you wanna plug in there?
I don't know, man. So when are you gonna be a guest on my show?
Whenever, just let me know.
This is tit for tat, man.
Yeah, whenever.
Pro quo.
No, for sure. We'll get to
that. I just reach out to us. It's OptimizeUcenters.com. OptimizeU Evansville on all the socials. Optimize Evansville Podcast Network on YouTube. Don't be discouraged. There's a lot of shorts on there, and there's only 2 episodes, but there's way more coming. So,
cool. Get subscribed,
like and
now,
subscribe us,
so that way
please.
all the videos, whenever they come out, you guys got them coming too.
Yeah. So, and again, any comments or questions, you can reach out to us through all of that stuff. And I'm Dr. D Urban Shaman on Instagram, so feel free to I answer a bunch of questions through there too.
Dr. Sheldon, I appreciate it.
Thank you,
That's
brother.
awesome.
I appreciate you, man.
Yes, sir.
You got a beautiful setup here.
Thank you all. Appreciate it. You guys, I love you. Make sure you guys head over to Hydrate12 IV Therapy. You can find them on Facebook and Instagram. Get your IV scheduled today. Thank you guys for the support. We got more guests coming every single week. Subscribe to the channel so you don't miss them. I love you guys. Peace.